everybody, and welcome today. I'm going to start doing some videos with different patients and just doing interviews with them to give you an idea of the different conditions that I treat, the different ways that I work with patients, and Miss Kay was nice enough to volunteer to do an interview, and so we'll go ahead and get started. So, welcome Miss Kay, thank you for coming.
Thank you.
Why don't you start by telling people what brought you to me?
I was diagnosed with polymyositis and also diabetes, and I was having difficulty with movement and range of motion in my arms. I had severe stiffness in my neck, difficulty swallowing, and my diaphragm was weakened as well, so I had difficulty coughing. I could barely lift my arms up. I was unable to get out of bed on my own, and a lot of times my husband had to help me up. I was very unstable on my feet. I had that sense that I was going to fall. In fact, I did trip and fall a couple of times because I didn't have the strength to catch myself. And I could not get myself up off the floor. My husband had to help me. So I was just having various types of weakness in my hips, my core, my upper thighs, and in my shoulders and around my neck. So it had really affected my life drastically as far as my ability to move, and it caused a lot of anxiety, and then came COVID.
Right. So we happened to see each other at the ball field because our boys play baseball, and I noticed you were having a really hard time moving, and I asked you what was going on, and you told me. And I had never actually heard of polymyositis because it's a very rare condition. It's an autoimmune condition that causes your muscles to get so inflamed that they start to attack themselves and the surrounding tissues. And what it does is exactly what you said, is it tends to attack those muscles that are closest to your trunk. So your hips, your thighs, shoulders, neck, core, ability to swallow, all those things get affected. And you actually had quite a severe case. So because I hadn't really heard of it, I researched it, tried to figure out what could actually cause this. In Western medicine, they have no known causes for this. It just hits. And so what I did with you is we sat down and I said, well, what could have led to this horribly, inflammatory condition that hit you? And so you had a lot of digestive issues. You had diabetes, you had high anxiety, and you were fairly sedentary. And so those are the things that we wanted to focus on when you first came into the office. So because it was COVID times, you were a little bit leery about coming in and getting treatment. So what we did is we put you on a nutrition plan. And so what we wanted to do is take out everything out of your diet that caused any kind of inflammation. And, with the hopes also long-term of getting you off of your diabetes medication. So when you first came to me, you were on steroids, you were on metformin,
Yep.
and you were on methotrexate.
Exactly.
Correct?
And folic acid.
And folic acid. Okay. So we put you on that nutrition plan and you dove head first into it. You were doing great. I put you on something along with the dietary changes, something called a continuous glucose monitor, which is so helpful for diabetics because you are able to see at a moment's notice what happens when you eat certain foods.
Mm-hmm.
And it's a great educational tool. So you dove right in. I think the first thing that happened is that all your digestive issues went away really quickly.
Mm-hmm.
I think when you were first diagnosed with diabetes, your A1C was at 11, which is
exactly
very high.
very high.
It was fairly controlled when you came to see me. Was it in the high fives? Or
I think it was when I came to see you. It was in the high fives.
And that was on 2,000 milligrams of metformin.
Exactly.
And with the dietary changes, you quickly started to reduce those numbers. Your blood sugars stayed stable. You decreased your metformin along with, advice from your doctor. We took you off slowly but surely. And over the course of a few months, you are now completely off your metformin.
Yeah.
I thought it was interesting that the last month or so, when I felt that you were ready to get off of it, you were nervous.
Mm-hmm.
Oh my gosh, what's going to happen with my blood sugars? But you took that leap of faith, and you've been off it now, I think, for a month or two.
Right, since
And
December.
Yeah, and your last A1C was
5.3,
5.3
which
off
is
of medication.
totally normal.
Which is beautiful.
She couldn't believe it.
Yeah.
And that I was off the metformin and now the prednisone. And sees improvement in my range of motion and my movement. So yeah, that was my biggest goal, was to get off the medication, and was so relieved to be off of it because of the side effects from the metformin, from long-term use. So my next goal is to get off the methotrexate.
Right.
So,
Which your doctor is not, right now, it's not ready for you to do. And that's fine. We're going to, take the medical advice and not try and override that, which I never want to do. I always want to work in conjunction with your Western physicians and what advice they give to you.
Yeah.
The other thing that we tackled with you was your anxiety, which was really, really high. And of course, you had trouble swallowing. You couldn't get out of bed on your own. You could barely walk. And
COVID.
So COVID on top of
It
just
was-
keep piling it on.
Yes.
But you found the acupuncture, not only did it improve your muscle strength, but you noticed a profound effect with your anxiety, if I remember right.
Yes, it definitely, when I first came in, I wasn't sure, like, if this is something I wanted to pursue. So I came in for a couple of times, and I started to notice the difference in just my stress level, my anxiety. But along with that, I noticed the pain that I was dealing with, or the heaviness. Because with the polymyositis, on top of the loss of range of motion, you feel like a heavy weight is sitting on your shoulders, especially in your shoulder area and around your neck all the time. I noticed that was the first thing to go, and then the anxiety. And then I realized that I needed to come more consistently, and that's when I really noticed a difference.
Yeah.
Almost immediately. As soon as I would get the acupuncture, I could feel like that heaviness gone, but mostly my strength returned. And I felt way more stable on my feet. I wasn't having, so it was like a vicious cycle where I would have fear of falling, and then my anxiety would go up. So all that really cleared up, plus my stomach issues.
Right. Yeah, you lost weight. Your husband jumped on board, and he had lots of digestive issues, and you told me he's doing great now and has lost a ton of weight.
Oh, and he loves the plan. Like, he says, if he has a day where, like, let's say he eats something that is not on our plan, he feels it.
Yeah.
And he's like, tomorrow, let's get back on the plan.
Yeah.
So that's good.
And that's the good thing, is once your body recognizes what is good for it, as soon as you put bad stuff into it, it will tell you, right? Our bodies actually try and give us signals all the time. We just don't want to listen, right? Because we get into that pattern of, oh yeah, I had this and I'm not going to feel so great, but that's okay. But once you get further and further away from that, and you're good to your body, you put those foods in that don't do well with inside you, and it's like, oh, yeah. Okay.
It's definitely, it's a huge thing, because I didn't think I could do it. Like, I honestly, I had already been down the path of changing what I ate, but this was felt very drastic. But once we got in the routine of it, it was totally easy and doable, and you just feel so much better.
Yeah.
That was also causing me anxiety, was my stomach issues.
Right.
It was so severe.
Right.
So that was, I don't ever have any stomach issues. Like,
Yeah.
it's almost like I've forgotten that was an issue.
Yeah.
Until somebody brings it up or I think about it. But that was, all those things being cleared up really helps with the anxiety.
Right.
And we love the food. The thing I realize is the cravings
Right.
are gone, because my brain isn't sending weird signals to my body saying you're craving this, you're craving that.
Right.
We're okay.
Yeah.
And then we added in the intermittent fasting, which you recommended.
Yeah.
So.
And you guys are doing great.
Yes, we
Yeah.
feel so much better.
Yeah. And I think the interesting thing with you, and what I want the listeners to know, is that you came in and started feeling great. And what happens oftentimes is when you feel better, you think, maybe I don't need to go, or I could wait a bit. And then COVID numbers spiked again.
Mm-hmm.
Of course, we live in California where those numbers are high.
Mm-hmm.
And you got nervous again about coming in, which I completely get. And so you took some time off, and then you started coming back again, and now you realize, okay, this is something that really does benefit me. And for someone like you who has a chronic condition that you're going to have to manage
Mm-hmm.
forever, you're that type of person where a maintenance program, once we get you back to your old self, you're going to come in probably once a month just to keep, feeling great.
Yes.
But, not that I recommend that, but that's what happens. A lot of people will stop and then they'll come back and be like, oh, this really did make a difference. So now you know. You've been through it all. And are there any other comments you'd like to make?
I was going to comment about how when I first started the plan, you were totally available. Like, I don't have that with my doctor, with my medical doctor, with my Western doctor. I sometimes have questions about stuff that I need to understand, and she's great, but the thing that really helped me with you was the fact that you made yourself available via text or phone call at any time of the day, and that was worth it to me, because I had questions. I would get concerned because my glucose monitor would show, my number going up outside of my normal range, and you kind of calmed me down and said, that's really normal. That's what your body does. It goes up when you eat something, a certain something, and then it comes back down. And that you explained that to me, that was key, was the fact that it was able to come back into range. And for the most part, 95% of the time, stay within my range, which was 70 to 100. And that was totally off the metformin.
Right.
So, I have to say that my doctor said to me that she had never had a patient who had been so successful. She said the biggest issue that she has is she puts them on medication, but they continue the lifestyle they had before. They don't really make any changes. And she just, every time she sees me, she still can't believe it because of where my numbers were at. Yeah. And so she understands that, I've chosen to add you into the mix because it works. Yeah. And you're available all the time for me. Like, if I have questions, I think my questions are less now. Right. But back then I think I was calling you every 5 minutes.
Yeah, but my tagline is healthy isn't hard. It's just educated empowerment. Mm-hmm. And that is my goal, is to educate you. Mm-hmm. And that means, when you have lots of questions, I'm going to answer them so you feel comfortable, you feel calm, and you feel like you know what to expect and what's going to happen. And once I give you those tools, you just go and you run with them, and you put them into your lifestyle, and you're good to go. And that is always my goal. Right. I don't want people dependent on me. I want to give you your life.
It's an adjustment, a life adjustment, but so worth it. And we've managed to pass this down to our son. And so we see a difference even in him, and his skin, and just his moods just better. Yeah. So it can hit every aspect of your life. Mm-hmm. So all right, well, thank you so much for coming in and talking. I really appreciate it. No problem. All right. Thank you. All right, everybody. We'll talk soon. Until that time, stay safe and keep smiling.